Hello, everybody, and welcome to the first weekly Independent Sage briefing. I'm Zach King. I'm going to be hosting today. And before we start, I'm going to hand over to Professor Anthony Costello to welcome the group.
Good morning. Welcome on this lovely sunny day. Thank goodness it's Friday. And welcome to the Independent Sage. And we're looking forward to a very lively, open discussion over the next hour or more. We're starting by looking at the government data published this week in some detail, because we think it's very relevant to thinking through whether many of their schemes are working in the way that ideally they should. And first, I'm going to hand over to Professor Christina Pargle, who's Professor of Operational Research at UCL, to give a presentation. Christina.
Hi, everyone. Let me just share my screen. Okay. So I'm going to just be presenting some slides on the latest figures on COVID-19 in the UK. The data come from a combination of the government's daily figures, so the stuff that they would have been presenting in their press conference, the Office of National Statistics weekly report, and then also the government's report on NHS test, trace and isolate. The latest one was released yesterday. So just to give you an overview of what that means, so I'm going to start by looking at new deaths from COVID, then the number of new hospital admissions in the UK, then the number of new people who have had a positive test, so that's kind of called confirmed cases, and then kind of onto a bit more new things, kind of the number of new infections, because there are more people who are newly infected every week that actually get tested. And then I'm going to spend a bit of time looking at the NHS test, trace and isolate results, because these are just really important to understand how this is working, because it does underpin any kind of lifting of restrictions from lockdown. And end on just why the numbers matter, like why we're showing these, and the European context. So the number of new UK deaths from COVID, yesterday there were a new 149 recorded compared to 137 a week earlier. So although we are kind of way down from the peak, which is a really good thing, it has kind of started to level off this number of deaths. And bear in mind that deaths reflect people who were infected about 3 to 4 weeks earlier. So you're kind of seeing what was happening at the beginning of June. And so the people who kind of unfortunately died recently would have probably been infected at the beginning of the month, which is actually before some of the more recent lifting of restrictions. This is the number of new UK hospital admissions with COVID-19 per day, broken down by nation. So again, you can see obviously a massive drop-off since the peak. Scotland has had no hospital admissions in the last 10 days, which is really, really good news for Scotland. And on the last day that we have data available for, the 21st of June, there were 318 new admissions to hospital compared to 387 a week earlier. And again, there is a bit of a lag here. Hospital admissions reflect people infected about 2 weeks earlier. So now on to the number of new confirmed cases. So this is people who have had a positive test. So it's somebody who develops symptoms of COVID and then gets a test and it's positive, and then that gets recorded here. So yesterday, there were just over 1,100 new confirmed cases compared to just over 1,200 a week earlier. So it is a decrease, but it's not a large decrease. And I think what you can see, if you look at this rolling average, which is kind of the week average, and what that does, it evens out any differences from weekend reporting. You can see that there has been a kind of a leveling off in these new confirmed cases over the last 2 weeks. And that's not because we're doing more testing. The number of tests we're doing every day, or at least the number of tests that they say they're sending out every day, have been about the same for the last few weeks. And I've also just marked here when in England we had some lifting of the restrictions. So schools partially reopening on the 4th of June and non-essential shops reopening on the 15th of June. The government's current estimate for the R number is between 0.7 and 0.9, but I think given that we are seeing this kind of leveling off here, it's more likely to be closer to 0.9 than it is to 0.7. But how many actually new infections are there each week? So we know we aren't picking up all newly infected people with testing. Like, we do know that. But it's actually then really hard to work out how many people are getting that infection. And there are lots of different ways of doing it. I'm looking at 3 here. There's the Office of National Statistics, who run a bi-weekly big survey of 30,000 people where they test as many people as they can for COVID. There's the University of Cambridge, which has its epidemiology model that feeds into SAGE, and then King's College London from their COVID symptom tracker app to provide estimates of new infections per week. And if you look at what these are, their best estimates are somewhere between 16,500 and 30,000 new infections per week in the UK. And that's between 2,000 and 4,000 a day, roughly. If you compare that to the 1,000 roughly of people who have a positive test, you can see that we are clearly missing some people. Because they're based on small samples of the population compared to how big the UK is, there is a lot of uncertainty. It is quite hard to know exactly how many new infections there are, but the best estimates are somewhere in this range, so somewhere between 20,000 and 30,000 a week. What's new is that both the Office of National Statistics, which is based on a survey of 30,000 people, where they test people, and King's College London, which is based on their tracker apps, say that numbers of cases now leveled off in recent weeks. So what that means is that we've been seeing the steady decline in new infections since April, which has been really good news, but that's stopped now. So for the last 2 weeks, actually, we haven't been reducing the number of people infected every day. So in that context, let's move to NHS, test, trace, and isolate. Because the whole point of trying to do this is that you're trying to keep a lid on the pandemic while allowing the economy to open up again and people to start moving around again. So firstly, just to think about what it's trying to do. So what you're trying to do with a kind of a test, trace, and isolate system is to find as many people with COVID-19 as you can, talk to them, ask who their contacts are, trace their contacts, and ask those contacts to self-isolate. That's what you're trying to do. And in theory, if you can do that, then you stop people infecting other people. So in practice, most countries, including the UK, only try to find people with symptoms. And that means that they're actually already kind of ignoring people who don't have any symptoms. And that's because they're much, much harder to find and much less reliable to find. So only about 40 to 50% of people ever develop symptoms. So if we kind of use the estimates from those 3 different methods that I said earlier, we can assume that about 75,000 new infections over the last 3 weeks. And I took 3 weeks because that's now the latest reporting for NHS test, trace, and isolate from this time period, 25th of May to 17th of June. And of those, maybe 30,000 will get symptoms of COVID. And what NHS test, trace, and isolate should do is find as many of these people as they possibly can and trace their contacts. That's what it's trying to do. So how many of these people actually did get a positive test? So this is the number referred to contact tracing after a positive test. All of these numbers now are coming from the government report. And what we're seeing is that there is a gap here, that we're not finding somewhere around 10,000 people who should be getting a test but aren't. But of those who are getting a test and have been referred to the system, the next step is to say, right, well, can I get in touch with them and ask them who their contacts were? And so of that, about 72% of people who they've referred have actually been reached by contact tracers. Now that's not bad. Actually, this is the population you care about, and you're only reaching half of them. So already you're not trying to reach these, you're trying to reach these, and you're only managing to get in touch with about half of them to ask them about their contacts. And then once you're in touch with them, can they tell you who they've been in contact with? So the people that they've reached, only 66, only about 2/3 of them actually provided at least one contact to the contact tracers, which isn't that many. The people that didn't provide a contact said it was either that they didn't think they had been in contact with anyone, or that they didn't know. So like if you've been on public transport, you might not know who you were in contact with, or they didn't want to. But again, if you're looking at the population that you should be looking at, that's actually only a third of people with symptoms who've got to the stage of providing at least one contact to a contact tracer. But then what? So this is kind of the people who we now have some contacts for. So all of these people, this remainder, are not being traced, and they can potentially infect others. And then these people who we have contact for, how many of their contacts are they reaching? And here actually it's quite good. They're reaching about 80 to 90% of contacts given are to isolate. It does seem that people aren't giving quite as many contacts as we would expect, so we don't know all the contacts are being provided. But the key thing about contact tracing is that it works through isolating contacts of infected people, right? And that's how you break the chain of transmission. It's not from isolating people with symptoms, it's from isolating their contacts, because you're most infectious before you feel ill. And so getting those people to stay home before they get ill is the key thing.
Christina, can I interrupt you briefly? There seems to be a slight issue with your sound quality in the last couple of minutes. I wonder if, are you on a plug-in mic or are you?
No.
No.
I can hear fine.
Okay. Let's carry on for now, and we'll see if there's any change. I've just got a couple of messages through, but please carry on.
It is quite indistinct, actually. There is a problem.
I wonder if it's the internet or something. I could move room.
Why don't we do this? Why don't we take a question from the public whilst Christina moves room, and then we can come back in. Does that work?
Well, it'll take you 2 seconds.
Okay.
Speaking closer to it was much better there, where you just moved a bit closer.
Oh, what, if I'm really close?
Yeah, that worked much better, Christina.
Let's see how we go.
How's this then? Is that better?
Yes.
Okay. So you've been missing all my words of wisdom. Okay, well, the key...
You've been very clear.
Sorry?
I think most of us have heard it fine.
Yeah.
Well, I mean, the key point, and this is important to hear me for, is that we have no data on how many people contacted are actually isolating. We just don't know. And we also have no idea, the people who are isolating, how well they're doing it. It's quite hard to self-isolate. So some people might need support financially, some people might need support logistically, and some people might just need advice. And then you also need to be willing to do it, which is hard, given that now they're just about to reopen the pubs and the restaurants. So we don't know how successful the isolating is. And we also have no data on how many contacts go on to develop symptoms and get tested. So there's kind of this really key bit on how well it's functioning. There's no data published on. So this is kind of the last slide, actually, pretty much. So why does this all matter? Firstly, new daily infections have stopped their downward trend and have been level for the last couple of weeks. And I think Chris Whitty said recently that he was expecting this kind of level to carry on for about another 9 months into next year. If we carry on with 100 to 150 deaths a day, that's over 30,000 deaths. And I kind of think, we really, really need to keep that downward trend. NHS test and trace is not reaching enough newly symptomatic people with COVID. It just isn't. Possibly only a third of newly infected people are getting to the stage of providing at least one contact. And part of that is the finding, and I think government messaging on the need for seeking advice on testing if you develop symptoms, and then the importance of isolating if you're contacted has been largely absent this week. The crucial data of how many contacts are actually isolating and go on to develop symptoms is not being published. And now we're in the context where in a week and a half, or no, just over a week tomorrow, they're going to be lifting restrictions to open up more indoor spaces, allowing more people to meet and for longer, and reducing the guideline for social distancing from 2 meters to 1 meter. And we know that indoors is much riskier than outdoors. We know that face-to-face and longer contact is much riskier. We know that 1 meter is much riskier than 2 meters. That's all from SAGE. So we're adding a lot of risk all at once in this context of infections not reducing anymore, and test and trace not fully functioning. And then the other thing is that they're starting this change on a Saturday. All previous changes have started on a Monday. And they've ended the government press briefing. So it kind of seems as if they're sending a message that the pandemic is over. And this slide is just saying it's not over. This is the 7-day rolling average of new confirmed cases per day across European countries that are around our size. We're still quite a bit higher than other countries. And these countries which opened up earlier are now starting to see new increases. America is seeing a massive surge as they've opened up without good systems in place. And I think what worries me is that this largest increase is in Germany, where they have a really good test, trace, and isolate system. And I'm worried that we're going to be in a situation here where we don't spot these increases until it's too late. Thank you.
Brilliant. Thank you for that fantastic presentation, Christina. I think lots of great information there. We're now going to throw over, we've got a whole bunch of questions to get through. Can I ask those that are within the Zoom, please keep your chat function open so that we can smoothly go through the questions that we have. First up, I think we've got Debbie Tibber from Wood Green. Debbie, are you with us?
Yes, I am. Thank you for taking the question. I'm an MS sufferer, and I've been in the vulnerable stroke shielded group. And I'm wondering whether I should actually be ignoring the government advice and continue to shield, especially in the light of what I'm reading in the last few weeks about brain inflammations and other side effects if I should be unlucky enough to catch COVID.
Who would like to take that one? I'm looking at perhaps Professor Costello. You'd like to start us on that one? You're on mute.
I was wondering about Carl because he works at the Institute of Neurology and knows probably a bit more about multiple sclerosis. But generally speaking, the idea is if you're shielding, people are saying about opening up, it seems reasonable if you're abiding by the rules of keeping a distance, of not moving close to people, keeping at least 2 meters away and using a mask, that you should get fresh air, that you should get out, that you should enjoy the summer, but taking extra special precautions. But I don't know if anyone else would want to add to that.
Professor,
do you have experience of MS or not so much?
Not so much, although the autoimmune aspect, the immunological aspect is clearly related. I have to say, I'll answer really as a son as opposed to a panelist on the independent stage, because my father asked exactly the same thing last week, and I said to him, no, you need to keep on shielding until it's all over. Of course, shielding doesn't necessarily mean sequestered in your house. You need to get out, but you need to take those precautions that effectively minimize the risk of becoming infected.
Thank you.
Debbie, thank you for your question. We're going to move on now. Francis Mathos, are you with us there?
I am indeed. Hi, thank you very much. My question is, this past week we've seen some very large gatherings, such as on the beaches around the country, for instance. If you don't see a surge in new infections in the next 2 weeks or so, would this be an indication that perhaps the virus might be weakening or is even dying out?
Thank you for the question. Can I suggest that that is thrown to Professor Pillai to start with on that?
Hi, Francis. Thank you. Thanks for the question. It's a really good question. And it's about predicting the future and how we'll respond to that. There is no doubt that being outside is of lower risk than being inside. And to date, the vast majority of infections where it's well documented, the source of those infections have been inside care homes, healthcare settings, in households. But this, and that's the first thing. The second thing is looking at beaches. Of course, this was not just a regular beach. This was beach in effect. It looked like everyone was inside, so close together. it's not only about there, but it's how people get to the beach. Okay, the pubs are not yet open, but toilets are there, people queuing to go to the toilets, people maybe sharing cars to get there to the beach, or on trains, of course, which are indoor. So there are many aspects of everyone getting to the beach which are a risk. We clearly could wait and see where there is a spike, which may be a local spike. It may be distributed around the UK. It's difficult to say. This was just in one locality. Of course, people came from many different parts of the UK, or at least southern UK, to those beaches. So it may be difficult to pick up a specific significant increase. But I would argue we just don't want to have more instances like that. These are very risky incidents. And as Chris Whitty, the Chief Medical Officer, has reaffirmed, we really need to be sensible, and we need to be clear that this is not the end of the lockdown. This is about loosening slightly, but in fact, we're all responsible for the behaviours that will protect others.
Thank you.
Thank you. Perhaps I could invite Professor Riker to comment from a behavioural point of view.
Yeah. Well, the first is to echo that point. The key point to get over is it's not back to normal, and we can't act as if it is back to normal. Chris Whitty made that point. I think it's very important that we stress that point as well. But we've got to be very careful about the data. So, for instance, people made similar points about the protests in the United States and asked why that didn't have effects of spikes in infection. But then people looked at the overall data, not just the numbers who went out, but overall, did people stay at home? And what you found was, yes, some people protested, but overall, more people stayed at home. So again, there might be some people going to the beaches, but we need to look at the overall data. Secondly, the media loves pictures of people crowded and often uses telephoto lenses to make it look as if they are crowded. If you looked at the aerial photos, you found that most people were still trying to keep a 2-meter distance. And the danger of overstating the problem is that you begin to create a norm. You're told that everybody else is breaking a lockdown, not observing social distancing, and it makes you think, well, there's no point me doing it as well. So we need a balanced message. The message on the one hand, absolutely clearly, maintain social and physical distancing. It's really important, but let's not underestimate the number of people who are adhering and the atypicality of those who are not.
Thank you, Professor Riker. Before we move on, I'm just going to throw to Sir David King briefly, because I know he's got to leave us in a couple of minutes. So maybe you could comment on that question, but any
Well, I think that everything that I would say has been said. I think my focus would be, for example, on pubs, and I would actually ask publicans after July the 4th only to serve people outdoors, just stressing this point that it's indoors where you're most at risk. So when we look at the issue of pubs opening, I think this is an area where we've got to really be extremely cautious. And frankly, we would advise government not to open pubs at this stage. But if they are to be opened, we advise the public and the publicans, please be outdoors.
Thank you. And before we let you go, I wonder if you have any thoughts for the previous caller who's still shielding at the moment. Would you have any advice or comments to them, to those shielding? So, David?
No, I think, again, everything has been said there. The shielding, just staying indoors, is just incredibly tough. You have to be extremely careful and very sensible, but get some fresh air. I'm not saying that we should stay indoors. So I completely agree with what's been said.
Thank you. I think we've got Palab Ghosh next. Palab from the BBC. Are you there for us?
Hi, thanks, Zach. And thank you all. I just wanted to follow up on Christina's presentation, which was excellent. But the question is to anyone that wants to comment. How concerned are you about the fact that they still haven't been able to provide their end-to-end turnaround time? The SAGE says that in order to function most effectively, it needs to be done within 48 hours of the first test. That's all the contacts to be isolated so they don't continue to spread the virus. and also just your feelings on the quality of the surveillance that's available to government at the moment, because that's a thing that's going to be crucial, along with test and trace, to be able to identify hotspots and control outbreaks.
Gabriel.
Thank you, Pallav. Gabriel, do you want to come in first?
Yes, I think that those are very good points. I think the quality of the surveillance is a really interesting one, because as the numbers have gone down, of course, it becomes less, the confidence limits widen, and the element of chance in terms of people being included in some of those surveys changes. Some of the surveys are carried out, ONS, for example, weekly for 5 weeks, and then it goes monthly. So that will again reduce the sensitivity of the surveillance, and it becomes less and less useful. What would be useful, of course, would be the case-binding testing, tracing, and that would be our best idea of not just the number of cases, but where they are, which is most important. And you're quite right to stress this issue of the timescale. Timescale in terms of doing that is extraordinarily important. And that is why we have advocated very locally based systems, because it is that can cut the time so that people don't have to wait for a courier to arrive with a test the next day and then send it back the day after that. But they can get an immediate appointment to go to a walk-in or a drive-in testing place and get tested within hours, not days. And that would be a fantastic step forward. But you're quite right, that timing is absolutely important.
It looks like we've got a few of the group who'd like to come in here. I'm going to throw to Dr. Zubaida Haque first, please.
I was going to add, Gabriel, I think on top of that, there are real questions about the isolate aspect of test and tracing. And we're concerned that when it comes to isolating people, which is crucial in terms of suppressing this virus, there isn't a clear strategy from government about how that will work. Now, in the context of Black and ethnic minority households, overcrowded households in deprived areas, and multi-generational households, it's very unclear what will happen to in terms of how you're going to isolate people. The government has no strategy and no plan. In other countries, they've provided facilities for people to be able to isolate, including food and including finance. Now, there's been nothing of that with this government. Finally, there is the issue of the public information campaign in relation to the test and trace and isolate program. I haven't seen much of a public information campaign. I don't think it's very clear that people and the public know what to do if they've got symptoms, where to go, who to contact, or anything else.
Thank you, Dr. Haque. Does anyone? Should we move on to the next question? I think
I think Deenan and Carl both had hands up.
Professor Friston, do you want to come in? Deenan's.
Yeah, just to speak to the second part of the question about the quality of the surveillance data, and just focusing on the regional reporting of new cases and deaths. I think that's an important question, because putting those two kinds of data together on a regional basis gives you a lot of information about the way that the virus is being transmitted and the rates of change of infection. There is, I think, an issue here, and it's the nature and the quality of the data that's available through the front door. So ONS has lovely data on an upper tier authority level on new cases, but does not have in the right format the clinical side, the mortality and the death rates, whereas Public Health England has the converse. And it's very difficult to get the data that will speak to each other in the right format. So if you wanted to pursue this, I recommend you talk to Mike Cates, who's the chair of the RAMP initiative and the auspices of the Royal Society, who has made great efforts and keeps asking, where can I get hold of the data? And I believe that one of his team has actually built a website for people who just want to try and put all these data together. But it's not as easy as you might think. You know, we spent at least 3 to 4 weeks emailing around, trying to find somebody who just give us the data to provide upper tier authority level estimates the prevalence of infection and the new cases per day, which is, you know, an important metric, as we've seen from Christina's talk, which gives you a target for how many people you should actually be contacting and isolating.
Thank you, Professor Friston. We're going to go to another member of the public now. I'm hoping we have Esme Hannah up next. Esme?
Hi, yeah, thanks for taking my question. My question is, what impact has the introduction of face coverings on public transport and in secondary care settings had on infection rates since their introduction on the 15th of June? And if we don't yet know what impact that's had, how should and are we going to collect data about that?
Is Martin with us?
I think he's just stepped away.
Who would be best? Steve?
Professor Riker, maybe you can jump in on this one to start with.
Well, being a behavioural scientist, I don't know the figures on face masks. It's important to state, however, that face masks don't stop the infection. Wearing face masks does, and therefore how you wear them, whether you wear them well, they fit well, whether you touch them or not, how you dispose of them. And so the problem is that lab studies which show that they impede the transmission of the infection, of droplets and aerosols, don't necessarily tell us the full story. So it's quite true that actually we need good field studies which are difficult to conduct. But I do want to make one point about face masks and why I think they're particularly important. The issue that is absolutely central, as we've discussed right from the start, is to get over the message to people that this is not back to normal. If people think it's back to normal, then there will be a spike in infections and many more people will die, and we will have wasted all the efforts of the last 3 months. And therefore, certain things are really powerful as a signal of it's not back to normal. Wearing face masks reminds us we're in the middle of a deadly pandemic. What's more, given that the effect of face masks is more to protect others than to protect yourself, it also begins to set a clear social norm that we're concerned for others. So I think when we look at face masks, we've got to look at them in the round. Certainly, of course, we've got to look at the epidemiological evidence of transmission. We've got to look at the behavioral evidence of how they're actually worn, and also the behavioral effects, the normative effects of how they remind us, number one, we're still in the middle of this deadly pandemic, and number two, we're all in it together and need to support each other.
Interesting. Does anyone else have any comments on that subject, or should we move on?
Oh, Zubaida.
No, Anthony, do you want to go ahead?
No, please.
Well, I was just going to add, I mean, on top of that, of course, you're unlikely to wear a face mask in a pub. You're unlikely to wear a face mask in the restaurant. So all those places which will be invariably indoors, and you will invariably not be wearing a face mask because it's impossible to do so, are all likely to increase the levels of coronavirus and increase risk, which is why, of course, Sir David King suggested that it's too early to open pubs.
Thank you. Thank you for your question, Esme. We're going to now move on to Chris Berry. Chris, are you with us?
Yeah, I'm here. Thanks for taking the question. So I work professionally and voluntarily as a coach. So in the context of adult and youth sport, what do you consider as prerequisites before a safe return to normality? For example, a competitive football match at a sort of basic local level?
Deenan.
Thanks, Chris. In fact, Anthony and myself did a Sky Sports interview about Premier League football clubs opening up, and it was really interesting to hear what's happening. But of course, I guess the sort of community type of sport and training that you're involved with, unless you are also involved in a professional football club, but I suspect most of those settings don't have the facilities, the money that the professional sports organizations have, and some eye-watering sums that football clubs, particularly Premier League clubs are spending on getting all their players testing and staff testing and so forth. So so I say that. Having said that, of course, some basic principles, fitness is integrated into good health. And particularly for young people who've been off schools and so forth. So I'm sure we would all recognize the importance of being able to provide those facilities. Outdoors obviously is different to indoors. And with the risk being much more indoors. I know there's discussions about gyms opening and the space and how that's going to be done. I think the principles that that are guiding our infection control during lockdown of hand washing, recognizing that infection is passed by touch. So on our sports equipment and so forth, I think there needs to be great care as well as proximity. As I said, indoors is higher risk than outdoors, but we mustn't forget as well all the staff such as yourself who work with these individuals who are going to have far more contact with lots of people, staff within gyms who may be at the desk or maybe in a canteen and so on, that are going to have much more risk. And of course, any transmission in that setting, whether it's to those who are actually customers or whether it's those staff, will also increase the risk of transmission in the community. So I just reaffirm the importance of sensible infection control along the guidelines that have been set out, whilst recognizing the benefits to people psychologically, physically, and health-wise of being able to take part in activity.
Thank you. I think Professor Pargle also had something to add here, so maybe we could pass to her.
Yeah, just to add that there are some really kind of just quite simple precautions you can do, like not shaking hands, which I know is a really common thing you do in sport. Trying not to have people in changing rooms, like asking people to wait until they get home to get changed, even if that's a bit grim. Not sharing water bottles, things like that, just to try and prevent contact and close contact between people, or concentrating training on drills that don't require, say, tackling. I mean, you can imagine the kind of things that you could do to try and reduce the risk to people.
Thank you. We thank you for that question. We're going to move on now to Caitlin Doherty from the PA. I know you're without camera, Caitlin, but hopefully we can hear you.
Afternoon. My question's sort of in relation to the previous crowds on beaches question, but more from a behavioural perspective. The MP for Bournemouth was on the news this morning and was suggesting that when the place got too busy, it was pretty much impossible for police to clear the beach, A, because there weren't enough police, and B, because there were just too many people. A lot of people have been staying in for the last 14, 15 weeks. They have stuck by the rules, and as far as they're concerned, now they've got that little bit of extra freedom, they want to be able to use it. From a behavioural perspective, is there any way that mass overcrowding or, crowds of Liverpool fans celebrating their win can be stopped?
Professor Riker, I think this one is one for you.
Okay. Well, again, I would start by saying that we need to be careful about not condemning everybody and tarring everybody with the same brush. A lot of those going out are attempting to socially distance. And if they aren't socially distancing, and this was a similar issue that we had way back when there were concerns about crowding in parks and so on. Quite often people don't go out with the intention of crowding. They go out with the intention of just doing what they're told that they can do, and they have been told they can go out now, and finding themselves in situations that are crowded. So rather than condemning people, one of the responses is to say, well, look, how can we facilitate people being able to socially distance? Because people would prefer to socially distance. Nobody wants to get COVID-19. We argued way back, for instance, around the parks, that if there is limited space, then you increase the space. And that was never taken up, but arguments like we should be opening up the golf courses, or we should be opening up playing fields so people can distance, I think was one reaction to it, that respect people and try and facilitate and help them. So similarly, with the beaches, I mean, it does seem to me that one solution might be to see if we can create systems which alert to people before they go there what areas are crowded, what areas are difficult to social distance in, and begin to direct people in different places. In some other countries, for instance, when they opened public spaces and opened the parks, they had volunteers who would guide people to less crowded areas. So I suppose my reaction is, let's not start off by condemning everybody and branding them as COVIDiots. Let's ask the question of what is making it more difficult for them to do the right thing, and let's facilitate that with practical measures to guide people and provide them with more spaces.
Can I just add the importance of children and getting children into open spaces, and why we haven't been talking much more about getting children back to school in open spaces, because open schools would be, in my view, very safe, given that children are much less likely to get the infection in a serious way. And I think the idea that our children who've been out of schools for 3 months or more and could be out of school until September is a very bad thing. And we should be thinking creatively about ways that children can get into open spaces, for outdoor activities, for even teaching, for field trips, for all kinds of things that could be imaginative and restore the social value of being in a school and in a group and seeing their friends again. And my final thing would be, to me, the big issue in Bournemouth, being a teetotaler, was the alcohol at the end, which led to all the fights and people getting close together. So don't drink too much, because drinking reduces your inhibitions and is more likely to increase proximity and the risk of transmission.
Can I just add, it's also a lot of people in urban areas, in disadvantaged and deprived areas, areas where Black and ethnic minority communities live, there's very little green space. A lot of people don't even have gardens. And we have to recognize that 3 months is an extremely long time for those people not to have got out. So what we're saying as Independent Sage is it's important to get out, it's important to exercise. I completely echo Anthony's comments around the need for children to be out in open spaces. It is a national scandal that this government has essentially abandoned children in that sense and not thought about summer schools or outside schools. But I also want to echo Professor Riker's comments, which is, let's not condemn those that do go out, recognizing that many people have been indoors for a very long time and stuck indoors without any access to green space.
Thank you. I'd like to invite Liam Warden to ask a question. Liam?
Yes, thank you. I'm a journalism student at the University of Sheffield, and my question is, earlier this week, Boris Johnson was challenged over ditching the NHS COVID-19 app. So far, the government has spent over £12 million on the app, and earlier Christina was explaining how only a third of those who develop COVID-19 symptoms are being caught by the contact tracing system. So my question to you is, how essential is it for an app to be a part of the NHS test, trace and isolate strategy?
Deanan.
Hi, Liam. Thanks for the question. Just briefly, of course, any mechanism that allows us to rapidly get information for purposes of controlling the infection is useful. But we have tried and tested methods for infection control for a number of outbreaks in the UK, which have worked very well over the generations. We mustn't be Luddite about this. I think we've got to consider new technology and opportunities, but equally, I think the statement that we would depend on this was, I think, ill thought out. It was premature, and whilst there could be some advantage of app-based mobile sort of technologies to access some people and be able to get that interaction going. We've got to recognize as well that there's still large proportions of the population, particularly the elderly, for instance, who are not covered in this way, and therefore it may be the cherry on top of the cake, but it's not going to be something we depend on.
I see Gabriel with his hand up, and Alison Pollock may want to say something. Gabriel.
Well, I think it's very interesting. You don't have to look very far to see countries that have done very well without the benefit of an app. The Republic of Ireland is down to very, very few cases now, and it has managed that entirely without an app. They expect to have a working app available sometime next week, based on the German model. It will be a very useful addition, I think, to that case finding mechanism that they have. But I think the fuss over the app, it's not absolutely necessary at all. And there's been a constant, in my view, there's been a constant stream across this whole epidemic of attention being paid on something that people think might be a silver bullet, whether it's antibody testing, whether it's the app, whether it's herd immunity, and it's all wrong to go that way. What we need is a whole series of measures that are additive and, in fact, probably synergistic, that may have a small effect in them individually themselves, but together it adds up to a whole community and a whole country getting rid of the virus. And I would much prefer, rather than spending time on wasting time actually in developing apps that don't work, that the effort went into try and getting good case finding and good local places where people can go and get tested right away if they need to, and with expanding testing so that in due course contacts could be tested immediately without waiting for them to develop symptoms. So we should be certainly looking to develop that whole system, and the app would be nice to have, but it's not an essential part, and I would hate it to be a distraction from putting a really good system in place.
Alison, you're muted.
Professor Pollock.
Thanks. I think everybody's said it all. I would just add that one of the reasons why the apps got into big trouble in Europe and in Germany was because of public trust over data and what was going to happen to data and data sharing. So while an app is maybe very useful as support, there is a really critical need to evaluate it and to make sure that the public can trust what is happening to the data and the data sharing elements as well. And I'll stop there.
Thank you, Professor Pollock. I'm going to now pass it over to Kirsty Elliker. Kirsty, are you with us?
Hi. Yes, I am. Hi, I'm Kirsty from Cambridgeshire. And what I'd like to know is, what is the safest way to have children learn in a school? Are there statistics that support the government's plan? And would you send your children to school in September when the class sizes are going to be bigger?
Carl?
Professor Friston.
Yes. All my children are grown up now. Yes, I think I probably would if things unfold in the way that we anticipate under the modelling, given the data that Christina has been presented, qualified by this, how things are going to unfold in terms of the resurgence of new cases, not necessarily deaths due to unlocking, and in particular, say, Bournemouth or Black Lives Matter marches, under the assumption that those will not slow down the decline in infection rates, I would be quite comfortable sending my children, if they were of that age, to a classroom of at least 15, but possibly even 30. And I sort of mention those quantitative numbers because it's numbers like that that matter in terms of the risk of your child becoming infected. You know, how many times, how many contacts on average will I experience a day? And if you can quantify that and the probability, you can work out very precisely how risky it is to to go into a crowded classroom. Our previous analyses suggest that by September, the probability that of your child at least becoming infected and subsequently developing a fatal illness is almost negligible, and certainly less than the probability you will be involved in a road traffic accident en route to school.
Can I pass this to Professor Riker to tackle it as well, please?
I do have a 16-year-old, probably in the other room as we speak, and I most definitely would send him back, because I think there are severe harms and by children not being at school, and it massively increases social inequalities. If anything is having an impact on inequalities, if anything is being causing harm, it is the fact that children aren't at school, or to be more precise, I think it's something like 85% of private school children are getting lessons as normal because they have the technology, they have the computers, they have the staffing and so on. So the people who are suffering is everybody but the elite. And I think it says something about a society and its values that we have opened the pubs before we've opened schools. And I think had there been the requisite efforts and the requisite preparation and the requisite forms of involvement, I think it would have been possible by now. So, for instance, one of the principles that we've argued very hard for is the notion of co-creation. With every policy, if you want people to adhere to it and go along with it, make them part of it, involve them in those discussions, don't just dump it upon them. And we saw with education, the absence of that dialogue led to people having fears, risks, leading to conflicts, and leading to a complete U-turn by the government. If we'd had the preparation, finding the extra spaces where children could be in classes and could still be distanced, we could have opened the schools. So here, I think it's very clear we want to minimize harm. Closing schools is doing harm, and we need to put all our efforts into this. And the final bit of the jigsaw, which takes us up back to where we began, is if we had a good, functional test trace system, we would be much more confident. Because the problem in schools probably isn't the children to children transmission or the children to adult, it's adult to adult. It's the risk to the teachers, it's the risk to other workers, it's risks to parents as they come to the school gates and so on. If we had good tracing, knew where the problems was, it would be much safer. So as I say, I think it's an absolute scandal. We live in a country which has put more effort into opening its pubs than opening its schools.
Thank you, Professor Riker. Can I invite Dr. Hack to perhaps add to that comment?
Well, yes, I think I completely echo what Dr. Riker said, that it is a national scandal that pubs have opened before schools and not everybody goes to pubs. So, I mean, that's first and foremost. But the other thing is why have we given up? There's another 2 months before school starts in September. Children have been out of school for 3 months. Now, we were very clear to the government that it wasn't a question of either children going into school or staying out of school. There was an entire out of school venue option where they could have opened schools in more open places. There were lots of places that were closed, like community centres, hotels and so on, sports fields. All of those places could have been used, and more importantly, can still be used to get children out. I think it's absolutely right not to think of education as just about learning. You know, that's been a huge issue, and we know that there's a growing inequality gap in terms of learning, but school is not just about learning. It is also about the social, psychological well-being aspect of being with your peer-to-peer groups. So we would still like the government to not abandon these children, to not walk away until September, but as Stephen says, is to build a test, tracing and isolate system which makes sure that coronavirus cases are still low in the community, because schools are not in a vacuum, social vacuum, but also to start investing in summer school programs and in workforces beyond teachers which can work with school children.
Thank you, Dr. Hack. I'm conscious of the time, but we've got a couple more questions that I'd like us to get through. So we'll keep going if that's okay. Can I invite Alexandra Thompson from Yahoo to ask a question, please?
Oh, yes, yeah, there we go. Hi, everybody. So a question for Christina. Is she still here?
She is.
Yeah, hi. You mentioned how we don't have data on who's adhering to the contact tracing when they're contacted. Is that something that could realistically be done? Do you have a suggestion of how that could be possible? Because I suppose people don't have to be honest.
I mean, people don't have to be honest, but you could at least do some follow-up phone calls. I mean, I would have expected there to be follow-up phone calls just to check how you're doing in case you are developing symptoms. Not least so you can encourage people to get tested if they do. I know that there was a study, I think, in Sheffield where they looked at how well people were isolating and found that only 30% of people adhered to the full kind of suite of things of never going out of your house, getting people to deliver food and things. And I think just having some idea of what people are doing is just crucial. And I suppose, I mean, I guess I would ask Stephen as the behavioural specialist, but like there are ways of asking that aren't judgmental. You know, it could be along the lines of, are you struggling with this? Is there something we can help you with? And you can find out that way.
Can I just say that the whole trick of this is from the moment a person gets a symptom through to isolation should be 3 to 4 days. The Chinese, when they started, had 12 days and they got it down to 3 days within about 2 weeks. Okay. And they did that largely with a local system. One of my big issues with test and trace is it starts with the test result. And that could already be 3, 4, 5 days by the time, you know, a symptom to a test result. So with test and apps, as soon as you get a symptom, you want to have a system that will rapidly get the test going, get the involvement of local people. Now, just to say, we have 21 health protection teams up and down the country who are real experts in this. This is under Public Health England. And we have 300 and something local authorities who've got public health teams. And you've got a lot of GPs who are really committed to this and could set up hubs so that tests could be done. And more importantly, they could tease out the symptom profiles that might be suggestive of just a cold or something through to whether they've got COVID or not. So I think, you know, we've got to use that system backed up maybe by contact tracers, but thinking about the system we have, HPT, health protection teams, public health, GPs, and then really measure that time from symptoms down to isolation. Of course, the GPs will know their patients. They'll know many of their contacts. They will be able to reassure them, refer them if they get sick. So we've got to build in the system we have, relying on just apps, distant tests, contact tracers who actually aren't doing most of it, as Alison will say. I think we've got to refocus the way we run this system.
Professor Riker, would you like to just further comment on that?
I want to stress as absolutely central to all stages of the test system, the issue of support, which I think has been completely underplayed. And when Boris Johnson was asked about it in the Commons this week, his response was a vague, nobody should pay for self-isolating, without giving any indication of what support would be given. So let's start right at the beginning. You know, you're beginning to feel a bit poorly. You know, you're beginning to get a bit of a temperature, you're coughing a bit. At what point do you decide that's enough for me to feel ill and for me to get a test? And a lot of that is going to be down to what are the consequences. If it's going to cost you to self-isolate and it's going to cost all your friends to self-isolate, then you'll hesitate. You'll take an extra few hours, you'll take an extra day, which, as Anthony has said, makes all the difference. And then when you're contacted, you're told someone you know has got the disease, and you're told, please self-isolate at a point where you're feeling well, at a point where everybody else is going out. Are you going to do it or aren't you going to do it? Well, if there's a cost to doing it, if you're going to lose money by doing it, then you're not going to do it. And what's more, it's not enough that there's no detriment. We've got to incentivize people. We're asking them to do something difficult. And here's where we can be bold and imaginative. We could have a scheme which brought together the government, local community groups, the local private sector. You know, your local football club will say and help you, and, you know, it will give you a signed shirt from your favorite player or whatever. A bold and imaginative scheme which says, how do we incentivize people? Then there will be an advantage, and people will self-isolate because they'll get something positive from it, quite apart from the support of their community. And without support, and without a bold, positive scheme which positively incentivizes people, this scheme will never work. And so that's one of the gaping holes in this system. It could be as good as you like in the middle in terms of the testing and the tracing, but if it's got a gaping hole at the end, this is a ship which is bound to sink.
Thank you, Professor Riker. We've got 2 more questions, so I ask for your attention for a few more minutes. Can I invite Elizabeth from the BMJ to ask a question, please?
Hi. So the heads of the BMJ, Lancet, Royal Colleges and the BMA this week called on UK political party leaders to commission a cross-party review, forward-looking, not assigning blame for the past, into how the UK can prepare for and prevent a second wave. Would ISAGE support that call? Do you think it's important? I'd just like to hear your views.
Maybe in the absence of Sir David as the figurehead, Anthony, I can throw this one to you to start with. You're on mute.
Well, speaking personally, I would endorse a review. I'm worried about public inquiries that take 5 years. I mean, look at Grenfell, and we're 3 years on, and we still have no kind of accountability for the people that were behind a lot of the mistakes made there, which led to so many tragic deaths. And my worry about public inquiry is that we could easily have a judge appointed and an inquiry that goes on for 5 years. And by which time, you know, there won't have been the proper lessons learned, right accountability. So I think a more rapid one, but I think I'd like to hand over to Alison Pollock on this one.
Professor Pollock, you're on mute.
Yeah, thank you. I have the same reservations as Anthony about a public inquiry. We only need to look at Chilcot. Nevertheless, it's really important that we now are ready for the autumn and the winter. We might have a little, little spell of being able to relax a bit, but there's no doubt that come the autumn, the winter, we're going to have influenzas, we'll have upper respiratory tract infections. So we really need to make sure that our health and social care systems are ready to respond, and that we don't need to shut down all the elective care and stop all the other urgent treatment, cancer care, cardiac care from going on. So a public inquiry is all very well. It should only take 2 months, no more, but it should be as part of the planning for the way forward to make sure that the plans are in place for this autumn. We can't wait, we can't delay.
Thank you, Professor Pollock. Before we move on, perhaps Professor Pargle, you'd like to just say something to this?
Well, just to echo it, really, is that, you know, when the first wave came, we had maybe 6 weeks of warning, and then maybe a few weeks seeing what was happening in Italy and on the continent. And it turned out that wasn't enough for us. We could have done more, but, you know, you could see that happening. But we've now, by the time autumn comes around, we'll have had 6 months. And if we don't learn from the things that we now know and we didn't know then I think that's unforgivable. So I think something has to happen so that we can keep schools open, so that we can keep elective care open, so that we can help. We don't have to shut down again. I mean, yeah, sorry, a bit incoherent then at the end.
Thank you. Before we move on, Professor Scally, would you like to just add to this?
Yes, I think the point that was raised in that letter was extraordinarily important. And I think that was added to by the CMO's remarks about things not really getting any better, possibly until the spring. In fact, he would be surprised and delighted if they didn't get worse by the spring. But staying the same until the spring, I think, is a terrible prospect. What we do actually need to see is what the government intends to do, how they intend to run through these next number of months, and what preparations they will put in place. And they should be putting in place good local health protection arrangements in every part of the country that will be robust, that will not only see us through this period, but when a vaccine hopefully comes through, we'll be able to organize a rapid vaccination campaign. Now, that doesn't require a public inquiry or anything like it. I think it depends how a rapid piece of work is done, but that's what it is. It's a rapid piece of work, but it has to have the confidence of the people of the country, and it has to be led and publicly led, and it has to be open and transparent. And there is no reason why that should take more than a month or two. At the longest, by the end of the summer, we should have a clear picture presented to us as to how the government is going to respond over the next 9 to 12 months and the scenarios against which they've based that plan. And I think that's what, in my personal view, that's what the people of this country deserve. We can't go on with uncertainty and hoping that it'll be all right and then coming up with instant responses when a problem strikes. We need to know what the plan is.
Thank you, Professor Scally. Can I invite Kevin Gemmell, if you're still there, Kevin, to ask your question?
Hi. Can you hear me?
We can.
Good. The government have been unwilling or unable to provide data on how many people are actually being tested for over a month now. How important do you consider that data, and what other data regarding testing or otherwise is missing that you believe is essential for us to be in control of the virus going forward?
Can I suggest Professor Pargle comes in on this one first, perhaps?
Actually, I think this is really for Gabriel and Alison.
Okay. Yeah. The baton's been passed. Professor Pollock, can I ask you to address this one?
This is a really good question about what data are missing. And we've got a number of issues, as you know, because the chair of the UK Stats Authority has already highlighted the way in which data are being collected for testing that are not useful for monitoring the outbreaks or contact tracing. But in terms of the missing data, what we really don't have is the good data on the suspected cases in the community, the numbers of suspected cases that are being tested and of those that are test positive. And these are the really early warning signs in the community that will let us know what's happening. When we get to the state, hospital admissions and deaths are good, but they're the tip of the iceberg. So we need much better data. We also need much better data collection on the tests and the testing, and it needs to be related back to people and to cases. So there are lots of data issues, and perhaps we need to do a special data session on the data sources and some of the problems with the data and what is being counted. I'm trying to be...
Professor Scally, do you have anything to add to that?
Yes, just one thing, and that is, I think repeatedly independent sages emphasise the importance of case finding and encouraging people who have symptoms to come forward and to be cognizant of what the symptoms are. And there has been, I think, as has been said earlier, there hasn't been enough public information around that. And we really need to know how many people are coming forward, are getting in touch with the NHS in various ways, through general practitioners or through centralised telephone numbers, the number of symptoms that they are reporting and how long they've had those symptoms. And then we need to know what's happened to them through the system, and the current situation whereby numbers of tests are published, but those tests could have been more than one test on one individual, so we don't actually have the number. And then still some of the elements of counting tests when all that they're counting is the dispatch via a courier of a sampling kit. A sampling kit is not a test. The test is done in a laboratory, not by Amazon or Royal Mail. Thank you.
Thank you, Professor Scally, and thank you for that, Kevin. Oh, Professor Friston would like to come in before we move on.
Yeah, just very briefly, I just wanted to highlight the simplicity and the importance of Kevin's question, because if we don't know how many tests are being done, there is no way to interpret the number of new cases, unless you have to make some simplifying assumption like they haven't changed. So this is a really important question. And at the national level, people in America are surprised and wondering what on earth happened to that data. It just stopped a few weeks ago. adds a significant degree of uncertainty to the forecasts and the nowcasts.
Thank you, Professor Friston. We have one final question that I wanted to pose to the group before we say goodbye. This is from Sarah, who has social anxiety, and she's asked us this on Twitter. She says, am I being too overly cautious by not going to visit my 79-year-old dad, given that my husband and eldest child are going to work every day, one of whom is traveling by bus? Do any of you have any words for someone like Sarah and people within her position? Professor Costello, Professor Pargle first, maybe.
Just to say that is a really difficult situation. Personally, I think if you meet him outside and you stay 2 meters away and you don't touch, and if possible, even talk side by side, so you're not facing each other, then I think the risk of anything happening is really, really small.
Did Professor Costello have anything to add to that? You're on mute.
I would agree with Christina. I think it's very important to have social contact with your elderly relatives. My sister has visited my 95-year-old mother in her care home, and my wife and I have been to visit our mother-in-law in her care home, and they have perspex and all the rest of it. But I think actually Christina's point about outdoor sitting at a distance should be perfectly fine. And I think the whole issue of social anxiety, I think, is the biggest issue of all, in a sense, because I think there are so many people in this country who are extremely worried about things and actually wanting to do the very best thing of all. But I think Christina's point was correct, and I saw Gabriel had something to say.
Professor Scally, anything to add?
It was very much what Anthony said. I think it's fantastic that you're asking the question. You shouldn't feel anxious about it. All you're doing is you're a concerned family member and you want to do the best for your family, and that's a good thing, and you're to be commended for it. And I think lots of people will be facing these sorts of decisions and choices, and that's one of the reasons why Independent Sage is here, to try and help people make their own decisions about their own lives and without feeling at a loss and anxious about it. I hope that's all been very helpful to you.
Thank you. Well, I think that is going to bring us to a close. It just leaves me with the pleasure of thanking, obviously, the Independent Sage panel, but also those who've joined us on Twitter and YouTube, and those who've put questions forward. This is the first of the weekly briefings, and we hope to be doing more of these in the future. So thank you, everyone, for joining us. Goodbye.